name is Chris Pratt and I'm the Chairman of the Rights Review Committee of Western Care Association. I'm the father of an autistic son. I'm here making this DVD in my... I'm taking time off work. I work in a voluntary capacity, as do approximately 50% of the members of the committee. We began work as a committee about 3 years ago. The members of the committee that aren't doing it in a voluntary capacity would be members of staff, professionals working in the field. We meet once a month. Our meetings are about 2 hours and we work outside of normal working hours. We have our meetings outside of normal working hours. Naturally enough, quite a bit of the work of the committee goes on between meetings as well. But that's the basic structure of our setup. We began work 3 years ago with 5 services who volunteered to work with the Rights Review Committee. They were all services in the adult area, adult day, residential and respite services in the east and north of the county. Members of the committee conducted an extensive rights survey in these services, which meant visits, of course, interviews, discussions with people. It was a thorough and exhaustive survey, and the analysis of the information received took a long time, but it resulted in a number of recommendations to the Chief Executive Officer of the organisation. The recommendations we made were in the following areas in no particular order: medication for the control of behaviour, living situations, skills teaching, relationships and sexuality, the coordination of services and incident management. After the work on the survey, we moved on to look at individual cases. The way we did this was that we asked regional service managers in the organisation to come up with a case each in their area, in particular spheres like living situations, like relationships and sexuality, like all the areas pretty well I've mentioned just a few moments ago. But we added to that locked doors, and we added the area of health and safety and confidentiality in the area of sharing personal information. Members of the committee visited these individuals and or their advocates, members of staff, family members, and we produced a series of recommendations both to those individuals and to the Director of Western Care Association. Our idea was that these recommendations would have a ripple effect around the organisation, so that if there was somebody who realised that there was somebody they worked with, say for example, who had an issue, a rights issue concerning medication, then they could look at the recommendations we'd already made with regard to an individual through this process. The survey and the individual cases that we looked at occupied most of our time during the first 2 years of our existence. In addition to that work, we have received accident and injury data from Western Care on a regular basis. This information has been analysed, and we have made recommendations relating to the way the information is collected, and we have had a direct impact on the design of the accident and injury forms themselves. We have received a number of presentations, the committee have received a number of presentations during the last 2 or 3 years from the Behaviour Support Service, a presentation on medication for the control of behaviour and its effects and side effects, a presentation on risk management and balancing rights and safety. We have sought engagement from the advocacy group, and we have become aware of major deficiencies in this area relating to the way people with learning disabilities might engage with services in a meaningful way, including, I might say, our own committee, the working of our own committee. All the members of the the Rights Review Committee have also done outcomes interviews. Most of the last 9 months have been spent at looking at ways of opening ourselves up for business, if you'll excuse that expression, because we couldn't continue working on this very selected basis that we have been operating on up to now. And we produced a frequently asked questions document which is in the process of being distributed throughout the Western Care Organisation. We don't know what the response to that will be. We shall soon find out. We're aware of the fact that we're working in an area where there are very few markers. It's, as one of our committee members described it, it's a little bit misty and even sometimes foggy out there. So we'll respond as we see fit when the time comes. We're quite flexible about the way we work. But we're hoping that this initiative will make a big impact on the way we work in the future. The biggest problem I think we have as a committee is just the time that we have, or the lack of it. And some people would say perhaps the way we manage that time too. Some people would feel that there is an issue regarding the awareness of the work of the committee within the organisation. That might be an issue. I myself feel that if we can have small and subtle effects on the way the organisation works and the way individuals look at one another and look at the people they work with, I think as long as we can be part of that process, I'm quite happy. We're all learning. It's an area where we're going to be making mistakes. We might lose direction at times, but we're hoping it's a cooperative venture and that we're doing this together with other people, and other people are helping us to do our work. And we're doing our best. We hope that our existence might make a difference to some person, some individual somewhere, and we're aware of the fact that what might be quite a small thing to us in the issue of rights can in fact make a very substantial difference to someone with a learning disability in our services. So I'd like to thank you very much for your attention. It's a brief overview of our activities and I hope it's been of some help to you.